If you could just state your full name just for the file. To begin, can you tell me a little bit about your current role, if applicable, and the work that you're doing? So, touching on which organization you're currently with, which sector, your primary focus area, things like that.
Thank you so much for having me. I'm Dr. Skola Matovu, and I am a nursing professor at the University of Utah College of Nursing, where I'm also the director of global learning and engagement in the college. And, I'm a researcher, a neuroscientist. I study grandparents who care for grandchildren. So I'm very excited to be here. Thank you so much for having me.
Great. And it's a real pleasure to have you part of our Global Fellows community at One Lift Health. And we're really excited to be putting together the story about your leadership and the change in health impact that you're creating through your work and your research.
Absolutely.
Great.
Thank you so much for having me. And yay to Women Lift Health for all the uplifting that they do for so many women leaders around the world. So I'm a proud alum and I'm excited to be here.
Wonderful. Great. So, to kick off this interview, we'd love to first hear a little bit about the specific area that you could call a health challenge, but what specifically brought you to the health sector and where you are today. So, was there any specific experience or turning point that motivated you to work in the sector?
Sure. I often say my journey into health and research, began with my jaja or my grandma, a long way before I ever stepped into a classroom to study nursing. And I grew up in a small village in Uganda, in Tebe. It's no longer a village, but it was really rural back then in the 80s, where my grandmother was trusted as a source of care for people in our community, referred to as a musao or healer. And many families could not afford healthcare in that environment, so they would come to her seeking help for a variety of health concerns they may have, whether it's a pregnancy and they're visiting for her prenatal care, or other community members who would be seeking remedies for themselves or for their children for illnesses such as colds or malaria. And so as a little girl, I think one of my jobs was to accompany her in that work, intentionally or not. And she would send me to the nearby bushes to collect these specific herbs that she used in healing others. And I remember learning which plant to look for and carefully, bringing them back to her. And this is, I think, almost 5 or 6 years old. And at that time, I didn't really fully understand the significance of what she was doing, but I knew that there was something special about what she did, and she was trusted by people, and I was very inspired by how she used her knowledge to care for others, even though she could not read or even write. And so I grew up, and as I got older, I began thinking about my future. I often found myself reflecting on her example that she sort of set for me. And I knew that I wanted a career that would allow me to make a difference, especially amongst the people in my communities. And so nursing felt like a natural fit in terms of the career that I had to choose that aligned with, what I witnessed with her in terms of compassion, in terms of service to our community, advocacy, and commitment in improving health, even in her limited way. And so looking back, I think I realized that my grandmother was my first role model in healthcare. She inspired my desire to become someone who could serve others that way. And that early influence really ultimately set me on the path of becoming a nurse and now a nurse scientist and a leader committed to improving health and well-being of the communities that I'm passionate about.
Fantastic. That's wonderful. And I'm sure your grandmother would be extremely proud
I hope.
of your career path that you've chosen.
Yeah.
And so for today, could you tell us a little bit about the specific focus area that you'd like to talk about? I know you've referenced grandparent caregiving. So could you talk about why this is important to bring attention to it?
Oh, gladly. You know, earlier on in my nursing career, I had the privilege of caring for patients and their families at bedside. I worked in a med-surg oncology unit for years, 15 more years, or 15 or more years. And I loved nursing and the opportunity to support people during these very vulnerable moments of their lives. But earlier on in that career trajectory, excuse me, I began realizing that I was increasingly interested in finding a deeper meaning or asking deeper questions behind the health challenges that I was seeing. I wanted to understand not only what was happening to people, why they ended up in these hospital beds, but why it was happening, what could be done to improve their lives more broadly, way before they get into these healthcare spaces. And so I started thinking about pursuing a terminal degree, and I spent a lot of time really reflecting on what issues I wanted to dedicate my career to. You know, I still have a little list of do's and don'ts. PhD masters, I still, had that reflective materials that I used. And I kept coming back to my Jaja, to my grandmother, in terms of wondering about her own experiences. As a little child, I didn't ask those questions. I wanted to know what that was for other grandmothers like her, whose contributions often go unnoticed. And so it was that curiosity that ultimately shaped my PhD dissertation, and that really launched the research program I continue today, focused around grandparent caregiving, not only understanding their lived experiences, but looking at ways to improve their health and overall well-being as they carry on this role that is often heavy, as rewarding as it may be, but for the most part burdensome. And so that is the focus area of grandparent caregiving that I decided to focus my career on.
Great. And to clarify, when you say grandparent caregiving, is it grandchildren caring for their grandparent, or is it the opposite of grandparents caregiving for their grandchildren, having to skip a generation, whether the parent has been taken into other spaces or not? Can you clarify that?
Oh, absolutely.
Yeah.
Thank you for asking that question because it's really key. When we think traditional grandparenting, we think about that grandma who takes care of the babies over the weekend, gives them the cookies and spoils them and sends them home after the
Mhm.
weekend. But I'm talking about not just grandparenting, but providing primary care for
Yeah.
grandchildren because the
Mhm.
parents are unable to, whether they have passed on or they are experiencing challenges, financial, substance abuse, other socioeconomic challenges that they cannot be able to fulfill their parental responsibilities.
Mhm.
And so these grandparents, older individuals who are preparing for retirement and the evenings of their lives, are now taking on a parenting role at a different time with different challenges, physical, age-related, and other challenges on top of the challenges that come with the caregiving itself. So it's
Mhm.
that full-time reparenting, as the primary caregivers of the grandchildren.
Mhm. Great. That's excellent. And in terms of the specific gap that you're seeing in this space, is it more focused on providing a supportive infrastructure for the grandparents while they're um, raising their grandchildren? Is it what specific element are you focusing on in this space for this particular community?
Sure, and I will expand even much more.
Yeah.
But just to your question, directly here, all aspects, right? Because
Yeah.
we lead with listening to the stories and
Mhm.
understanding, meeting grandparents where they are, grandparent caregivers, and then work with them to build solutions that
Mhm.
address their needs. And so that is the span of the work,
Mhm.
for the past 14 years and as I move forward. So the focus changes or
Mhm.
sort of complements, and in prior work informing the newer work as we continue to support them, whether it's individual or structural or other kinds of support that
Mhm.
we build together with them.
Great. And have you been working mostly with the grandparents themselves or their grandchildren directly or both in your work?
So primarily grandparent caregivers, and I'll tell you why. Because when I started this journey of my research, the questions, especially given the literature at the time that we had, was about who is caring for those who are dying of HIV? Because my
Mhm.
foundational work was in Uganda. And looking at the literature in sub-Saharan Africa, the focus was who is caring for the children when these
Mm,
individuals die. And so the focus continued to be on the children, rightfully so, right? And
mhm,
that is consistent with other literature in different parts of the world, depending on what the antecedent for the caregiving may be. The concern is, oh, where are the children now that the parents are struggling with substance abuse, where,
mhm,
and so the focus was not directly on who's caring for these individuals, what about their health and well-being so that they
mhm,
can sustain the support and care of the children. And so
mhm,
it continues to be a gap in terms of, being an invisible caregiver. And even as we broadly think about what family caregiving is and resources and services available to family caregivers, often the grandparents and mostly grandmothers who are the ones who
mhm,
usually step in, they remain invisible because some of
mhm,
these definitions are often, um, you know, uh, uh, supported by, say, Medicare or Medicare or medical conditions, such as caregivers for people with dementia. And so a
mhm,
grandmother caring for a grandchild, again, falls through those cracks. And so it was very important and continues to be that I clearly define who it is that my
mhm,
focus of research is in as an understudied, invisible population of grandparent caregivers and not just grandparents. I'm very
mhm,
intentional about that definition to
mhm,
ensure that we are identifying where the vulnerable group is that needs support and visibility.
mhm. Great. And were there any tools or frameworks or any specific resources when you were starting this work that helped you kind of identify and navigate um, this gap in need? Or was it mostly through conversations and so forth?
Unfortunately, there isn't that much literature or statistical numbers around, how many grandparents, worldwide are
Mhm,
caring for children. Again, what you see reflected in those statistics is how many children are being supported by, grandparents or more than 163 million worldwide. Okay, so how
mhm,
many grandmothers or grandparents? Those statistics are still missing.
mhm,
And so, we have to rely on especially qualitative research, which is critical to support the numbers that we may have or we don't have, or to begin informing the need to actually put the numbers. And that begins from the stories. It
mhm,
begins from qualitative research, really in-depth understanding of what are the lived experiences of these individuals, in-depth explorations of challenges, rewards, and, putting the stories to where the numbers would be assigned in the future when this work continues to be developed that way,
mhm,
supporting what we already know, especially in other regions such as North America, where we have the statistics and the census data that can tell us about how many grandmothers and how many grandfathers. Can we hear more about what those stories are and how do they differ internationally? And so, in terms of tools, the literature was not really providing us enough context of
mhm,
this diverse experience that is not only happening in one place but really globally. And we recently did a systematic review looking at more than 55 countries and looking at more than 30 studies that are really providing us a bigger picture of what these experiences are worldwide, and it comes down to that. It's the same experience, different reasons for the primary care, but the financial and other challenges and rewards in some aspects are very similar. And that's why my work is focused on advancing the visibility of or increasing the visibility of this research as a global phenomena because it's a shared human experience, no matter
Mhm.
where you are.
Yeah. Can you share some more highlights of what you found in that systematic review of those experiences? What were some commonalities or what were some differences based on geography?
Yeah, our research again, with the systematic review, but both in Uganda and in Utah has highlighted both, challenges, but certainly strengths of these grandparent caregivers. We have documented their financial hardships, health concerns, caregiving, caregiver strain, social isolation, whether it's in rural Uganda or rural Utah. As individuals get older, their social networks are much more less. And so they don't fit into the younger cohort of parents, for example,
Hmm.
school activities. Or, if it's in a deep village in Uganda or elsewhere, the younger generation is out either in the urban areas or out of the country to earn a living. And so these grandparents, especially grandmothers, isolated, caring for grandchildren without or with minimal support. And so, the complexities of raising grandchildren who may, for example, have experienced trauma. You see, we look at a place such as Utah, where we have more than 28,000, children under the care of their grandparents. And the main reason has been the current opioid epidemic. And so, these children are either born, and already exposed to substances, or, their early formative years surrounded by trauma and instability. And so the grandparents are forced to step in
Hmm.
and deal with that trauma-informed care without the training. And, whether it's that or it's, a grandmother in rural Uganda who is saying, well, these children are not respectful. They're not like my children. This generation is, they're abusive. And so the challenges are very similar in terms of the complexities of the
Hmm.
caregiving responsibilities, especially given that this caregiving happens over a long period of time. A grandmother may start caring for a newborn and all throughout their teenage years, and then maybe the teenager has a baby, and then they are taking care of the great grandchild.
Hmm.
So it's usually long term. It's usually very complex, and at the same time, we've identified these really powerful sources of strength. I
Hmm.
hate to call that resilience, but strength, including these intergenerational bonds that are created, especially with children who are experiencing loss of their parents, whether they are passed on or they are alive, but they're being challenged by substance, and so they cannot stay with their children. So the grandchildren create these strong bonds with their grandparents, and some of them call them mom, and the others call it because that's the intergenerational connection that they have that is so strong and that is so grounded in trauma and in pain, but also in purpose. You hear a lot of these grandmothers saying, this is my calling. This is what God has led me to do. This is why I'm here. The community connections that you see, especially in places in Utah where you have programs that some of the grandparent caregivers can attend to be in fellowship,
Hmm.
community with others like them, with families, kinship families like theirs
Hmm.
that can only be understood by those experiencing similar challenges.
Hmm.
So those are mostly, around the outcomes, but our work has resulted in research dissemination, for example, partnership development, designing of intervention, community engaged activities, and this campaign that I'm leading around this growing need for public awareness. In spite of the amazing role that they perform and remain unnoticed. And so
Hmm.
public awareness is important of the resources of the phenomenon itself. And what matters most to me, is that the grandparents are increasingly seeing themselves reflected in conversations, from which they have historically been absent. And, when a grandmother hears that there are other grandmothers on Capitol Hill who are telling their story, they feel represented in that space that they might never have the opportunity to be. Or if they hear a podcast episode talking about challenges, they can say, I'm not alone. And so that is the goal that continues to inspire my work, that these grandparents, especially these grandmothers, feel seen, heard, and supported.
That's great. And do you have any specific examples that you can share of maybe one grandparent's particular experience when they have felt seen? Or do you have any specific examples of, um, either policies that then came about from the increased awareness that your research has brought? Any particular examples you'd like to share?
Yeah, oh, absolutely. And I think the best way I can share that is through our current ongoing work.
Yeah.
We is, really guided by this core principle of meeting grandparent caregivers where they are, which is not only geographical, but it also means in terms of their health, in terms of their financial realities, in terms of their social circumstances and their emotional well-being. And so we begin by listening to stories again, and then partnering with, the grandparents themselves to co-create these solutions that reflect their priorities and
Mhm.
their lived experience. And I often say that we often, especially in healthcare and other fields, we have these amazing innovations, tools and devices in our clinical settings that, take more than 17 years to be approved. And yet these individuals are needing the support today, whether
Mhm.
it's a grandmother who has to carry a child with a disability on how
Mhm.
and walk for miles to go to a clinic, or a
Mhm.
grandmother in Utah who knows or hears about services, but they don't know how to navigate the system. And so this has led, to different solutions that we have designed in the different contexts after listening to these stories. And in Uganda, for example, where formal supports for grandparent caregivers are largely absent, we have developed the Bajaja intervention, which is combining health coaching, peer support, and income generating activities. And that is in response to what they have told us. The biggest and the most salient challenges are health related. Isolation and lack of the support network they need, and financial and sustaining their households. And so that's where that intervention co-developed and with them, and we are continuing to currently refine is about. And so when you hear grandmother, you ask for an example, who says, I would like to, purchase medications for my, blood pressure, but that's not priority because my
Mhm.
grandchildren don't have anything to eat. So you have to listen and meet them where they are, and whether, it's in Utah where the resources exist. In fact, Utah has the strongest kinship navigation program to support these families, more than many states around the country. And yet, most of these grandparents don't know how to access those resources, navigate these resources. And so we heard them, how do I go about the legal process to get legal guardianship? Because I cannot be able to take my child or my grandchild to a doctor's appointment without that. And so I'm forced to go to the emergency room, as one of the
Mhm.
grandparents said, where I'm worried about how I'm going to cover that with my limited retirement funds. And so we hear that, and it's important that we provide the resources on how to navigate. And so we co-created with these grandparents and providers in the community, the Grand Experience podcast that is community informed, community co-designed with these key partners, so that their voices are heard, so that they receive and access practical resources and help caregivers connect with the supports that are available to them. And so, it's not a podcast as any other, but, a really navigation and support and visibility tool that our grandparents can be able to use, to feel heard. I'm not alone when you hear another story of someone going through the challenge, or to hear a story of grandchild who is a grown like myself sharing their journey. And I have to tell you, walking and talking to these grandparents. One of the grandmothers recently, started crying in the interview we had, and she said, "Look at you, you inspire me. When I see where you are, what you've achieved, I want that for my grandchild. And you give me hope that my granddaughter will achieve the success, hopefully, from the guidance that I've given them if I'm not here 30 years from now." And you have no idea how humbling that is for me.
Mhm.
Ah,
Yeah.
just thinking of my life and my story, and as a little girl growing up in Uganda, to have a story that can inspire a grandmother in rural Utah.
Mhm.
I mean, what are the odds of that? So to me, that gives me purpose. That is what reminds me that the work that I do matters, and
Mhm.
that it transcends borders, and that
Mhm.
it connects to our humanity. Every grandmother, grandfather, wherever you may be, they want their children to be successful, their grandchildren to be safe.
Mhm.
They want their grandchildren to have a good life and a good future. And that has no color, has no language, it has no country borders around it. And so, you know, through these interventions and then the partnerships that we are building and the storytelling to increase that visibility, the goal for me remains the same, to ensure that the solutions are designed with grandparents, not for them, as the caregivers who are supporting the future of our world
Mhm.
globally.
Yeah, absolutely. And for the community that you work with in Utah, because I think this is something that we're particularly interested in, is how do you take the global to local,
Mm.
and how is it translated? What are the learnings? We of course know that there's overlap, but the community that you're working with in particular in Utah, is it a specific community, or is it just everyone? Who are you working with in Utah?
Sure. In terms of the grandparent caregivers,
Yeah. Yes.
Um, so we, especially in our current work that we are finalizing on the current research project, we are, working with grandparent caregivers in both rural and in urban setting. Uh,
Okay.
it's because we know that the challenges may be unique to those geographical settings in
Mhm.
particular. Access to, internet, the resources, transportation to get to where they can receive these services. Some, for example, may be taking care of four grandchildren with different developmental, behavioral, and health challenges, ranging from ADHD to, other challenges, and they have to drive from one end of Utah
Yeah.
to another to be able to access those resources. And
Mhm.
so the position or the geography matters, in terms of understanding what the unique needs are, so urban and rural, but certainly understanding some of the social cultural context,
Great.
of these individuals, whether it's religious, whether it's ethnic, or other kind of challenges, or I mean racial. You find that there are divides in terms of what may be available to them, and so seeking these diverse, perspectives on what are the facilitators and barriers to accessing, to knowing about, to using resources has been a big focus. Working with providers, and that is something that we don't have many studies on. Understanding in depth the perspectives of community providers, whether it's legal service providers or social workers or healthcare professionals who may support pediatrics and work with these grandparents in terms of transitioning care to home, or, the different groups. We wanted to know what their perspectives are on what those challenges are, and the facilitators and how best we can serve this population. And then, of course, working with the local organizations here to be able to support that work, and all those combined, working with them in, developing this one particular intervention as the podcast, but also other ways in which we can continue advancing that research in different ways. I
Mhm.
hope that answers your question.
It does. And it actually is a perfect segue into the next question was about partnerships. Because
Mm.
from what you've been sharing, it sounds a lot of this work has to be done through partnerships and collecting these grandparents with the necessary resources that they need to remove some of that isolation that they may be experiencing. So, could you share a little bit more about key partners, collaborators, or groups that are involved in this work? And how have you built, or what has been your role in building those relationships and coalitions in order to support grandparents in both Uganda and Utah?
Sure, sure. Thank you for asking. And you're right, absolutely. Partnerships have been central in, to everything that we've been able to accomplish today and what we plan for the future, both for the Matovu Research Lab, but also for our partners as well. And in Uganda, we have partnered with, of course, the grandparents themselves, in the communities, the nurses, local leaders, and community organizations to better understand caregiving challenges and identifying priorities for support. For example, in Uganda, going through this, my current grant and the clinical trial of looking at, how can we, reiterate, understand, confirm the challenges and use the rewards of that to support the interventions. And then we, pilot different interventions, gain more feedback on how better to refine so that we can best serve these grandparents with them as part of co-creation of such projects. So those are the partnerships in Uganda, for example. And in Utah, we've worked with organizations that serve grandparent caregivers and other kinship families. And again, these kinship families include aunties, uncles, friends, or family who care for children, who are often older, as in the caregivers are. And so such organizations is Grand Families Program, which is part of the Children's Service Society of Utah, one of, if not the oldest nonprofit in Utah that has been serving these communities for several years. And, to work with them and, especially with the grandparents that they work with has been a great opportunity. But we have other partners as well. For example, from the Utah Department of Health and Human Services that I serve with on the Utah Kinship Coalition. But most importantly, I like to emphasize that grandparents themselves are being our most valuable partners in this work because they have guided our priorities, as I explained in terms of the interventions we're working on. They have shaped the research questions that we are asking, we've asked in the past and currently moving forward as we think of other research ideas. They have informed how we then share those findings, right? Because one of the grandmothers recently, said, it's important to know about the research. And yes, I'm surprised that there's been ongoing research for more than 30 years. That is good to know, but what does that have to do with me today? How does that help me currently in the challenges that I'm experiencing? And that really, for me, shifted how I look at research dissemination.
Mm.
As scientists, as academicians, we generate knowledge, we share that in the journals, publish, we get promotion from it, and the people who study don't even receive that, in terms of findings. So how best can we share those findings in ways that are relatable, that are understandable? And so that has been critical for me to strengthen the partnerships that we have with the grandparents by sharing those partnerships. So that has been one of my leadership roles, is bringing together, around, individuals and partners around this common purpose and goal we have to improve the lives of grandparents and, helping the different groups, recognize that they each have a role to play in
Mhm.
support these families, whether you're a philanthropist, whether you are, a neighbor, whether you
Mhm.
are, a researcher, we have ways in which we can all contribute to supporting this population.
That's great. Fantastic. And I'm wondering if you can share a little bit about any challenges you have experienced with this work, either in conducting the research or implementing some of the initiatives and the interventions with the families that you've been working with.
Yeah, thank you for asking. I think the one one of the major challenges has been helping others understand that grandparent caregiving is not simply a family issue.
Mm,
It's a public health issue. It is a social issue. It's an aging issue. It's a policy issue. And, so rereading that message is critical,
mm,
especially to policymakers, for them to understand that this family caregiving system is sustaining multiple systems, foster care systems, legal systems. There are many other systems, the healthcare systems, and so reminding folks that this is not a family issue about, oh, so and so could not take care of a child, grandma will do that. After all, she's retired.
yeah.
And it's more than that. And I think emphasizing that to folks is important. And so we continue in terms of that advocacy to remind people that, without this safety net that the grandparent caregivers are, most of our systems will fall apart.
Mm,
Another, I think, challenge has been balancing the rigor with urgency,
mm,
ensuring that the research is strong while also responding to the real needs that the communities are experiencing
mm,
today. And that's what I was referring to as well earlier in terms of, a device that may take several years. The grandparent might not live to be able to, utilize that, or a legal eligibility barrier that
mm,
takes several years for the child to qualify, and
mm,
until then we cannot be able to answer that. Or as someone shared with me recently, the disparities in within the family systems themselves, where, for example, a grandmother with four grandchildren, or two of those foster children and two of those biological children, and the
mm,
fact that the systems don't acknowledge that those children have equally demanding needs and challenges, especially if they experience health and other challenges. But the fact that those in foster care might be able to get more financial support than the children that they're caring for informally as grandma, biological grandma,
mm,
is a problem in itself, because they are not supporting these children that have no control over how they got here, but
yeah.
but the systems don't see them the same way, you see.
Mm,
So it's those gaps that we continue to see, and the work, the advocacy, the policy recommendations have to target,
mm,
remind those in the decision-making positions and spaces to be mindful and know that grandparent caregiving comes in different forms. It looks
mhm.
different at different stages of development, and the different circumstances that shape it, and that we need to meet these grandparent caregivers where they are.
Yeah. Do you, this is wonderful, Scola. And do you have any examples, or have there been any specific moments when you've realized that your work is making a difference, that you're seeing change, that you are realizing that the advocacy that you're doing, the resources that you're providing, the connections that you're making on behalf of this community, that it's starting to work? And I think you had shared earlier that
Mhm.
one grandparent shared with you about just what you've symbolized to them. Are there any other examples where you're like, wow, this is creating change?
Yeah, I have to say that when I started, for example, the current work that we're doing around this increased visibility through a platform such as a podcast, that's not your usual research, um, uh,
Mhm,
a tool to investigate. And so I had my own reservations in time. Again, that where's the rigor, where's the research?
mhm,
And what grounded the ongoing work now is knowing that it's informed by the individuals that are impacted most. And that's what matters. Because if the research we engage in does not respond to the needs of the people and what they have identified as a solution, then what's the purpose of the knowledge development? And so some of the most meaningful signs of the progress we are making so far, they're not statistical in nature. There have been moments, as I shared with you. And I have several of those moments where the grandmother just says, wow, thank you. Thank you for this platform. because now I can hear stories and say, I'm not alone, or thank you. Now I know how to navigate a certain resource. I've been able to share my frustration, and I remember grandparents telling us that nobody has ever asked them about their experiences before. And interesting enough, I hear that in rural villages of Uganda and in mountainsides of Utah.
Mhm.
And I had a grandmother that I always, remember, just sitting with in the middle of the village in Masaka, deep in the village in Uganda. And this grandmother, started crying in the middle of the interview. And I said, "Why are you crying?" She said, if nobody has ever asked me this story, and
Mhm.
my story has been a sad story since I was a little kid who lost
Yeah.
my parents when I was a baby. And I went through a very challenging life, mistreated and, lost my husband, lost one child after another until I remained with one. And now they're all gone and I'm homeless.
Mhm.
But for someone to hear my story,
Mhm.
so for me, it's those moments, or when another grandmother expresses relief that someone is paying attention about their challenges, but also recognizing that I don't need pity. I just
Mhm.
need for someone to know that I love what I do, but I need help. So those conversations for me reinforce that visibility itself can be, it emphasizes that our visibility can be as powerful as the numbers,
Mhm.
and that they can support the numbers. And we know that. And we've also seen a growing interest in terms of these community organizations, other researchers who are reaching out for collaborations, service providers who also say, wow, I didn't know someone could interview me about what I think, because this is what I think, who are increasingly recognizing that grandparent caregiving as an issue is worthy
Mhm.
the attention and the investment.
Mhm. Wonderful. Wonderful. And with the last few minutes of our time together, um, can you reflect back on your leadership journey experience with Women Lift Health? And you're one of our original cohorts. And so it's been some time. And I would just be curious to hear how your experience in the leadership journey and what you gained from that, how has that influenced your leadership roles today and the important work that you're doing in the space that you've described?
Yeah. I really want to answer this very carefully,
Yeah.
because when I say that Women Lift, leadership journey was transformational, I truly mean that. And I want to, demonstrate that to you. I think before Women Lift Health, I saw myself primarily as a researcher, as an
Mm,
educator, a nonprofit founder. And I was comfortable leading, projects, mentoring
mm,
students, building programs, and sort of, going up the ladder in terms of promotion and tenure track and looking at that as leadership. I
mhm,
was focused on doing good work, but I didn't always recognize the power that my voice, my core values,
mhm,
my, intersectionality. I mean, all that
mhm,
have influenced how I could, lead beyond this immediate institutional, professional circles that I was in. So at the time, I remember my leadership journey project was centered around developing a leadership and professional development program for nurses in under-resourced settings. And this is part of my nonprofit Nurse to Nurse Global Initiative. And I entered the program hoping to gain these practical skills in leadership development, in partnership building, strategic planning, all that good stuff.
mhm,
And what I didn't fully anticipate was how, much of that experience would transform, while I was in the
mhm,
program, my understanding, of leadership itself. And I remember the framework of leading self, leading
mm,
others or with others, and
mm,
leading change or innovation that was introduced during the program. And the concept of leading with your core values, they were transformational. in terms of, for me as a leader in my early journey, that it created and it laid for the more leadership development opportunities that I've had. So that is one thing that I just wanted to say, you know, off top. And remind me, what was the question again? I just wanted, I sort of lost track there.
No, you were definitely hitting it. So it's reflecting on your leadership journey and what learnings from the program, from your time in the 12-month program, have felt most impactful in your leadership today in the work that you do.
Yeah, one of the most, I think, enduring lessons from Women Lift is the importance of lifting as you climb.
Yeah.
The program reinforced my belief that leadership should create opportunities for others. And
Mhm.
I've seen the power of that, especially, leading from my lived experiences and
Mhm.
focusing my own leadership journey on how I can serve others, whether
Mhm.
it's grandmother caregivers like my own Jaja or fellow nurses whose story and experience I know and understand, to lead from serving and creating opportunities for them. And so today I intentionally mentor students. I support emerging scholars and friends
Mhm.
who are pursuing, their own development. I connect colleagues to opportunities and create pathways for women to grow as leaders, not only in research but in healthcare, in academia. And I'm particularly passionate about supporting women whose talents may not always be recognized because of the systemic cultural barriers, and limited access to those opportunities. I look at my superpower. We spoke about that in the early days of Women Lift. What my superpower is me recognizing the privilege I carry as a Ugandan American with opportunities I've had for the amazing mentors I've had. I hold a certain level of privilege that I bring to spaces where my colleagues may not have. And I have to recognize that they hold a certain level of privilege I may not have. And so, especially as you do global health work, that self-awareness is critical. And I often think about the women who have invested in my own journey throughout and even ongoing, starting from my Jaja. They're amazing nursing leaders who have mentored me, stellar, mentorship and guidance along the way. Some who have showed me what to be and what not to be. And, I think Women Lift inspired me to be that person for others because, we are few at the top, as it is, as women, and even the more intersections you have as Black women, as you can find, other, intersections that limit the number, and invert that funnel. And so the more we lift each other to fill those spaces, to be in those rooms, to be of influence, I mean, come on. The power of that cannot be achieved by one person at the top. And so to me, there's nothing I lose from supporting others. There's nothing I lose from using my voice to advocate for grandmother caregivers. They may not look like me, but their experiences are relatable to mine. And so that is, I think, the biggest lesson I learned, and how that continues to, inspire how I partner with others, and the conversations I engage in, and connecting the dots between, my passions, my research in grandparent caregiving, my research in workforce development, and to be a voice and contribute in spaces of influence. And I'll share with you, I recently participated in the World Health Assembly in Geneva, which was a dream come true, to be able to be with those global leaders from organizations such as the International Council of Nurses and World Health Organizations. And those conversations to me reinforced the importance of connecting research to workforce development, to community health. They also reminded me that nurses and midwives, the largest global healthcare workforce, are uniquely positioned to lead solutions that strengthen families and communities. And so I think about supporting grandparent caregivers And I see the direct connection between my original Women Live project and my current research, because we need to be able to link the workforce, equip them with systems thinking skills, with leadership capacity, even at the lower levels of our profession where, often that's not invested. The confidence that they need to be able to work alongside communities to solve complex challenges, and whether it's in supporting nurses, grandparents or families, the goal is to ultimately, empower people to be able to be drivers of change within that in their community. So that's the foundation, I think, that Women Lived allowed me to see, especially as I, learned with and from this amazing cohort of women global health leaders that I was very blessed to be a part and to learn with. And so I don't know how much praise I can give Women Lift, and my hope is that we do get the support to continue the work and the vision of Women Lift in supporting women everywhere. And I love that we're spreading all over the world and continents, because that is so much needed. So thank you all for what you do. I truly, truly, I am a product of what you guys, the seed that you, Michelle, planted, and I'm very honored that you all are continuing to advance that. And I'm supportive of any other way I can.
Thank you so much, Scola. And I just want to send the gratitude back to you as well, because the work that you're doing, it's bringing so much important attention to underserved individuals, communities, populations, both here in the United States as well as Uganda. So thank you for your work and for your leadership, and everything that you have brought to the space. So as we wrap up, I wanted to see, is there anything else that has come to mind that you'd like to share with us today before we close out?
I think what the initiative that you all are embarking on in terms of, continuing to increase or support or elevate the voices of, women leaders along is important, because we need those voices more, especially when the noise around us is as loud as it has ever been and is getting louder. We need leaders who can be able to speak their truths, who can be able to advocate for others. And so what you're doing, and hopefully continue to do, in providing opportunities to, folks like me to come and speak about where our impact and influence is and how we can make a difference, that is an effort that does not go unnoticed. And so again, keep up the good work. Opportunities in which we can join efforts as alum, and we already see that within the networks that you've created for us to continue collaborations, especially in these bleak moments of that our global health is experiencing. The solidarity is needed more than ever. Because together we are a stronger force than individually. And so I think it's emphasis on, the gratitude for what you're doing, and, encouragement to continue doing that in terms of increasing the visibility, but also elevating our voices as we continue the legacy that Women Lived Health started.
Great. Wonderful. Well, thank you so much, Scola. And that concludes the interview. So I'll go ahead and I'll stop our recording.
Awesome.